Hello, my name is Shawana Piggy. I am a graduate student in the MS/HS in Laboratory Medicine program in the Department of Biomedical Laboratory Sciences at the George Washington University. I am very excited to present my capstone proposal project that I have been working on during this semester in the Current Topics in MLS course instructed by Dr. Yusuf Barzani. My capstone proposal project literature review title is Review of the Advances of Non-Invasive Techniques Being Used for Earlier Detection of the RHD Status in Fetuses of RHD Negative Pregnant Mothers. Do you know your blood type? What about your Rh factor? Is it A positive or O negative? Or maybe your blood type is different from the ones mentioned. Let's take a look at the Rh factor. You can see that red blood cells that are Rh positive have antigens on their surfaces, while red blood cells that are Rh negative have no antigens on their surfaces. In this research project, the focus will be on the Rh factor presence or absence in blood and its interaction between a pregnant woman and her fetus, specifically observing the RHD negative pregnant woman whose fetus is RHD positive. A RHD negative pregnant mother whose fetus is RHD positive is at a high risk of developing birth complications such as hemolytic disease in fetuses and newborns. The fetus inherits the RHD positive or RHD negative allele from its father, depending on the father's allele, while inheriting the RHD negative allele from its mother. According to the article titled RHD Zygosity and Hemolytic Disease of Fetus and Newborns, it states, HDFN results from the sensitization of the mother's immune system to paternal antigens on the red blood cells of the fetus, cited from the author Magnum M. 2013. During the first pregnancy, after interacting with the fetus's RHD positive blood, the mother becomes sensitized to the antigens and develops anti-D. In her next pregnancy with the RHD positive fetus, her developed anti-D begin to attack the fetus, causing hemolytic disease. Another way a RHD negative woman may become sensitized to RHD positive blood is if she receives a transfusion of RHD incompatible blood before pregnancy. Due to this, there is transfusion protocol requiring transfusion of RHD negative blood to women of childbearing age in an emergency transfusion. These are a few ways that RHD negative women may develop alloimmunization or become sensitized to RHD positive blood that causes HDFN. As advances continue in transfusion medicine, there has been a reduction of hemolytic disease development during and after pregnancy. The better understanding and detecting of RHD status of a fetus whose mother is RHD negative have dramatically improved the risk of the development of HDFN. Although the risk of the development of HDFN has improved, it still can occur. By developing a literature review exploring this topic, it will present the continued advances in transfusion medicine and prenatal care. By providing this data, it can be used by researchers to help them in their studies to further reduce the risk and rate of HDFN. Many technologies and methodologies are continuing to be developed in order to advance the detection of RHD status in the fetus of an RHD pregnant woman earlier than before. The graph on the right side displays the results of one study presented in the article titled A New Biosensor for Non-Invasive Determination of Fetal RHD Status in Maternal Blood of RHD Negative Pregnant Women, published in 2018. The image shows the biosensor's earliest detection of the RHD fetal status from the mother's plasma as early as at a gestational age of 8 weeks represented by the purple line labeled number 2, showing a steep curve. This is one example of many new non-invasive methodologies and technologies being developed to detect the fetal status in Rhd negative pregnant mothers. Specific aim number 1 is the new methodologies and technologies that are being researched for the detection of Rhd status of fetuses of pregnant women earlier than previous methodologies and technologies. This specific aim will focus on researching and developing a list of non-invasive methodologies and technologies that are being researched. The information included in these items will be name of the new non-invasive method. Next, the methodology, technology will be described for each. The specimen collected, for example, the mother's plasma, for testing will be listed for each non-invasive method. Lastly, the earliest detection time will be included in order to observe how early the Rhd fetal status can be detected using these methodologies. Specific aim number 2 is, through the use of these new non-invasive methodologies and technologies, the need for the administration of RHIG, RhoGAM, can be determined earlier than before. Currently, RhoGAM is administered to all Rhd negative pregnant mothers at a gestational age of 28 weeks. If Rhd fetal incompatibility with its Rhd negative mother can be determined earlier than before, RhoGAM can be administered earlier than before in pregnancy. This can help to prevent the risk of a fetus developing hemolytic disease earlier in pregnancy, resulting in reducing HDFN earlier than before. The image on the right shows how RhoGAM neutralizes the anti-D. This prevents the anti-D from attacking the fetus and causing HDFN. Specific aim number 3 is, through the use of these new non-invasive methodologies and technologies, the unnecessary use of RhoGAM can be determined earlier for fetuses who are not at risk for developing hemolytic disease. As described previously, RhoGAM is administered to all Rh negative pregnant mothers at a gestational age of 28 weeks and also after delivery if needed. If a non-invasive method to determine Rhd fetal compatibility with its Rh negative mother can be used earlier than 28 weeks, the unnecessary use of RhoGAM can be prevented. In this case, there would be no risk of the fetus developing hemolytic disease. The planned project approach is to conduct research to find additional relevant resources on describing new methodologies and technologies of Rhd fetal detection status. Research of the following resources include GW Hemopharm Health Sciences Library, AABB Transfusion Medicine Journal, Transfusion Alternatives in Transfusion Medicine Journal, PubMed, and additional resources as needed. These resources and findings will be presented and used to answer the hypothesis and develop a conclusion about new non-invasive methodologies and technologies being used in earlier detection of Rhd fetal status in Rhd negative mothers. The timeline for this project will be worked on and completed in a 15-week time frame. Weeks 1 through 4 focuses on continuing research for more relevant articles. The focus will also be on completing the introduction and hypothesis sections. Week 5 will focus on working on and completing the 3 specific aim sections previously discussed. During this time, the final research on relevant articles will be closed out. Weeks 11 through 15 focus on working on the references cited list and completing the conclusion section. Lastly, the literature review will be finalized and submitted. Here is the first page of the list of references. Here is the next page of the list of references used to develop this proposal project. Thank you for spending time listening to my Capstone proposal project. If you have any questions, please feel free to ask.